Is there one thing that families misunderstand about wound healing in elderly residents, and how do you handle those conversations with them?
Oftentimes, with all available resources on the web, families come to the bedside, or when we have initial phone call, they're already educated on latest and greatest in wound care, which is great. I love discussing these advanced techniques. But unfortunately, oftentimes the elderly patients will not be a good candidates for 4 to 6 hour surgery. Something that I would advise family to reconsider, and not subject patients to general anesthesia and very, very extensive surgeries to fix the wound right away. I understand, I'm a relative myself. I have elderly parents, so I feel, in their shoes sometimes when you wanted to have it fixed, the sooner the better. So I think sometimes, setting the right goals, for example, let's keep this wound from deteriorating, from getting infected, from needing ER visits. So that might be the reasonable goal in someone who is still enjoying, and we will obviously adjust the treatment plan, we'll minimize pain from the wound, we will make sure that the drainage is not soiling their clothes when they're presenting, and having activities, or whether it's medically related activities, or in a nursing home residence, social activities are just as important. As long as the wound is not affecting their lifestyle and it's healing, I think slower wound healing is to be accepted in a lot of cases. We don't want to be fixing the wounds at all costs and aiming for overnight solutions.